Very good morning to everyone. Dr. Nazin Madam has about total 23 years of experience, 18 years in academia and 5 years in pharmaceutical industry. Main area of specialization are pharmaceutics and novel drug delivery system. 3 PhD students and 54 PG students completed their research work under her guidance. She has published 41 research papers in national and international journal of repute. Total 6 patents are credited under her name. Among them, 2 patents are granted. She has published total 6 book chapters. Madam has organized 20 different seminar, workshop and conference and total 2 government granted projects handled by her. Different 6 awards were credited to her and so many times invited to deliver the lecture in various events. She is life member of IPA, MPA, APTI, APP and also editorial board member of World Journal of Pharmacy and Pharmaceutical Science. Today, Madam is going to deliver a talk on medication adherence. On behalf of Induka Kaikwala College of Pharmacy, I, Jinal Dandel, welcome you, ma'am.
Very good morning to everybody. And thank you, Jinal Madam, for such a nice introduction in the morning. So I am Dr. Nazneen Surti. I work as a professor with Induka Kaikwala College of Pharmacy. And today I am going to deliver a talk at the refresher course for registered pharmacists organized by Induka Kaikwala College of Pharmacy. Is my presentation visible?
Yes, ma'am, it's visible.
Okay. So before starting my talk, I would like to thank the course director and the principal of Induka Kaikwala College of Pharmacy, Dr. Harsha Patel, the coordinators of this refresher course, Dr. Bimal Shah and Dr. Usman Ghani Chalotia, for inviting me to deliver a talk at this refresher course. Today I'll talk something about medication adherence. We know what all it is, and by adhering to a medication, how we can enhance the patient's health and outcome of a therapy. I'd like to brief upon that. So this is what I'm going to talk about: adherence concepts and terminology, some statistics related to medication adherence, consequences of non-adherence, factors affecting medication adherence, prerequisites for adherence, how we can improve medication adherence, and what are the tools which help patients for adhering to their medication regimen. So we all know what medical adherence is, right? The patient, if the patient takes the right dose of medicine at the right time, in the right way, and for the correct period of time, then it is called as he is adhering to his medication regimen. World Health Organization defines medical adherence as the degree to which the person's behavior corresponds with the agreed recommendations from a healthcare provider. If a healthcare provider has told you to take a medication in a certain way for a certain period of time, then you have to adhere to it. Then only there will be health outcomes. Otherwise, they may lead to worsen your condition. So we all rely upon medicines, right? Either to cure or prevent diseases. We all know that it is very important. So medication adherence is actually the most important point in a medication regimen or therapeutic regimen. Still, this is the only point where we are weak. This is the weakest link in our healthcare system. And we as pharmacists have to strengthen this link so that it improves the overall health of the nation. So medication adherence becomes very important. It is important for everyone, right? But it is very important when we are dealing with chronic diseases where the drugs have to be taken for a longer period of time, and diseases where serum drug concentration should be maintained. There are some drugs, there are some potent drugs which require, and some essential drugs like anti-epileptics, where the drug concentration needs to be maintained or a narrow range, right? You cannot miss a dose. The drug concentration then will go down and the effect of the drug will not be seen. or medication adherence is also very important where diseases affect the general health of the public, like when there are some contagious diseases going on, you have to adhere to the medication so that you don't pass on the disease to other people. Then medical adherence is also important for replacement therapy, like hormones therapy, especially insulin plus other hormones, which our health is very dependent upon. Okay, so and medication adherence is most important on all the ages. I mean, like even patients, all the ages, for everybody, medication adherence is important. But it is more important for pediatric as well as geriatric patients where they need help to adhere to their medication schedules. So these are certain terminologies which tell you the behavior of a patient towards his medication. So the three terms are used: compliance, adherence, and persistence. Compliance is now disfavored, and compliance is not used much because it suggests that a patient passively follows the doctor's order. He's not really interested, but he is complying. He's taking the medication just because his doctor has told him to. Adherence shows that the patient is willing. He understands his diagnosis and he is willing to take the medication, and he believes in the therapy. Persistence is the ability of a person to continue taking medication, and this persistence means being there for a long period of time. Sometimes the therapy may last for months or years or even for a whole lifetime that a patient lives. So these are the three terminologies which are commonly used to describe the behavior of patients during their therapy. These are when do you call it that it is medication non-adherence? What all falls into medication non-adherence behavior? First is to fail to fill the prescription. You go to a doctor when a patient goes to a doctor when he feels something is wrong with him, right? The doctor writes a prescription, but you don't purchase those medicines. You don't go to the pharmacy and purchase those medications. That means you failed to fill the prescription for the first time. Even after you buy the prescription, you skip doses. You don't take all the doses that you've been told to take. Then if you've taken all the doses, if the medicine has to be repeated every 15 months, you don't go and buy those medicines again. You don't refill your prescription as you had been directed by the doctor. Then either you take more medications or less medication than prescribed. If the symptoms are less, you tend to take less medicine. If you've been told to take 3 times in a day, if the symptoms are less, you will take only 1 time or 2 times a day. Or if there are more symptoms, you tend to take more, but that should not be done because what is prescribed has to be followed because there is a reason that it is being prescribed in that manner. Then taking someone else's medication also falls under medication non-adherence. If you have symptoms similar to someone else, you can't take those medications because people are different in how they behave towards different medications, right? We all know that metabolism varies from person to person. All the ADME factors vary from person to person. So if one medicine is working with one patient, it is, I mean, you cannot be sure that it is going to work for you, even if you have the same symptoms. So taking someone else's medication also falls under medication non-adherence. Then taking expired medications, there is an expiration date on your medication beyond which you're not supposed to take the medication, right? Because the medication might have degraded. Then sometimes you're told by the doctors to take certain medicines with food, without food, with some drink or not with some other drink, right? So when you're told to do such a thing, then you have to follow it because there's a reason behind telling you that. Some medicines, the absorption of some medicines it goes down in the presence of certain food. Certain foods interfere with the absorption of some medications. They interact or degrade a particular medication. So those foods have to be avoided. Or you have to take food in case where you're taking a gastroretentive drug delivery system because those systems require food to be present in your stomach. Then if you store medications in the wrong place, again, they are going to get degraded. So that also falls under non-adherence. So once we know what is non-adherence, then we can find out what are the factors affecting this non-adherent behavior, right? Before that, I'll tell you some statistics related to medication adherence, which has been surveyed over a period of time at different places around the world. So almost 20% of the patient, this in some studies, this 20% is almost 50%, right? Some countries, this goes up to 50%, but this is a general thing which has been put here. So 20 patients don't fill that prescription at all. They don't, after the doctor has written the prescription, they don't go to the pharmacy and buy the medicines at all. Out of the people who buy medicines, 12% of those people, they don't take the medication. They buy it and keep it at home. They don't start taking that medication. Then 29% of the people stop taking the medication before it is finished. You buy 20 tablets, you've been told to take 30 tablets in 10 days, but you stop taking medicines after 20 tablets. So even before the medicines are over, you stop taking that medication. 29% of the people stop taking the medication. And 22% of the patients take less of the medication than is prescribed on the label. So, and in persons with newly diagnosed high blood pressure, if the person is diagnosed with high blood pressure and it is a new diagnosis, then after 12 months, the adherence goes as low as 78%. And after 54 months, the adherence is found to be only 46%. After 54 months, the adherence goes down to 46%. So these are the statistics, overall statistics, which are related to adherence. Now, examples of classes of drugs for which most non-adherence is reported. You can see that all these drugs, antidiabetics, CVS, HIV, and antibiotics, they are all taken for chronic conditions, right? We all know that for antibiotics, we have to take the full course of medicine. If you have been told to take tablets twice in a day for 5 days, then we have to take it for 5 days. If we stop taking after 2 days or 3 days, if our symptoms go away, we stop taking it after 2 days, but it cannot be done, because if you stop taking it before the course is over, then some bacteria may still live in your system and they might again grow. You might get the infection again. And over a period of time, these bacteria might become resistant. Then with HIV medications, the problem is the people who are suffering from HIV, they have to take multiple drugs, and the side effects of those drugs are also high. So we can see that adherence is also less with HIV drugs. Then drugs like antihypertensive, platelet agents, and statins. Sometimes a person who has hypertension will not feel the symptoms, or antiplatelet agent and statins are taken for symptoms which may develop after a long period of time. So even that people know that if they don't take these medicines, it is ultimately going to increase the risk of myocardial infarction or stroke. Nothing is happening immediately. So these drugs fall into non-adherence. Similarly with anti-diabetics, the diabetic patients don't get symptoms unless the sugar level becomes very high. So they are reluctant of taking medicines because they don't have symptoms, but they even if they know very well that over a period of time, if they don't take anti-diabetics, then they might get diabetic retinopathy, neuropathy, etc., etc. But some people don't know, and we have to make them aware. We have to educate the patients that not taking these medications is ultimately going to harm them. Then similarly, antiplatelet things and clopidogrel and aspirin, they doesn't show any effect as such, right? But they do help with your non-deposition of plaque in your arteries. This is medication adherence statistics reported by scientific reports in 2020. Here you can see the level of adherence, percentage adherence, and here you can see the drugs. So AC inhibitors like captopril, then P2Y12 receptor inhibitors like aspirin, and statins. So this is the result for the first quarter, adherence for the first quarter. As the time progresses, the adherence goes down, right? Up to the fourth quarter, it reduces in all the classes of medicines. These are the different classes of drugs, and these are the adherence, percentage adherence of patients after first quarter, second quarter, third quarter, and fourth quarter. If you consider this as 3 months or 4 months, then it goes down after 12 months. This is some of the statistics of antihypertensive medications taken by people. So high adherence, people adhere to antihypertensive medicines, percentage is only 16.2, whereas medium adherence is 47 and low adherence is 36.5. The other conditions where we can see non-adherence rates, high non-adherence rates are asthma. 25% non-adherence of up to 25 to 75% can be seen as asthmatic patients. Asthmatic patients, they take medications only when they feel the symptoms, when they are feeling breathless and all. They don't take preventive medications. They don't take the medications as prescribed. They don't take medication when they don't have any symptoms. Similarly, with major depression, schizophrenia, and anxiety disorder, these are all mental disorders where the patients have to be helped. They need help for adhering to their medication schedules. Again, there's a difference between adherence when we talk about males and females. In a study, they divided people into high and moderate adherence people and with low adherence people. In both the groups with high adherence and low adherence, percentage of patients adhering was high, and with males, number of males adhering was also high, and number of males non-adhering was also high in low medical adherence. But generally it is seen or it is observed in other studies that females are more adherent than males to their medications. Then what happens if you do not adhere to your medication schedule, right? If you do not take if people do not take the medications properly in the manner that they have been told, then the disease might progress. Instead of the disease getting cured, disease will get cured only if you take medicines properly. So if you are not taking medicines properly, then the disease will progress. Your disease is going to worsen, which will ultimately lead to increased hospital admissions. And hospital admissions will again increase the medical cost, also non-medical cost. It will increase mortality. The death rate is going to get increased because sometimes the disease progresses so much that then it is not controlled, that it doesn't come under control. So people die. If they don't die, at least there's a low quality of life they have to live with. If the disease progresses, then the patient is going to lose some of the functions, vital functions of life, and ultimately lead to low quality of life. And if you don't take medication, ultimately the medication which you have purchased is going to go waste, right? And ultimately it is going to affect the cost. These are again some statistics. How much hospitalization has occurred with diseases like CHF, diabetes, hypertension, and hypercholesterolemia. So you can see that if adherence increases, the percentage of adherence increases, the hospitalization goes down. If you compare 1 to 19% adherence with 80 to 100% adherence, you can see that the number of hospitalization have gone down considerably with diabetes, hypertension, and hypocholesterolemia. With CHF, it might not have been that different, but with diabetes, hypertension, and hypercholesterolemia, the incidence of hospitalization has gone down considerably when the adherence increased to 100%. So talking about the factors affecting medication adherence, once we know these are the factors these are the 5 categories which are given by WHO. WHO has divided the factors affecting medication adherence into these 5 broad things: socio-demographic factors, therapy-related factors, health system-related factors, condition-related factors, and patient-related factors. Okay, socio-demographic means something related to the age of person, the age, the race, the ethnic group, the culture that he belongs to, the gender, the marital status, the income, the education, the occupation, all these comes under the socio-demographic factors. So under socio-demographic factors, as I say, the age becomes a factor. So whether a person is very young, whether pediatric and geriatric patients are there, that will affect their medication adherence. Then if person is literate or not, whether he is educated, whether he can understand his diagnosis and whether he can understand the therapy related outcomes. So, and whether he belongs to a stable home, whether he is a survivor of war or disaster, whether he belongs to a certain social group or not. Then whether the patient belongs to a minority. The cultural differences also matter very much, right? If some cultural or if some religion believes that certain things cannot be eaten, for example, gelatin is obtained from animal tissues, right? So some people who are vegetarians, they are reluctant to take hard gelatin capsules. So for such beliefs, what can be done is changing the empty gelatin capsules to capsules which have been made for HPMs. Another factor that affects the adherence is if low income, like if the person cannot afford the therapy, how is going to comply or how is going to adhere, and especially for therapies which take a long time. Another things are patient related factors, right? So again, low literacy here is a main thing. Then patients are not adherent simply because they forget to take, right? Forgetfulness. Suppose somebody is going to office, he has to take medication in the morning and he forgets because he's running around. So simply he forgets. So medication adherence is not always intentional. There are two types of medication adherence, intentional and unintentional. So half of these things fall into unintentional and half fall into intentional. So a patient just forgets to take the medicine because he's rushing to the office or so many other reasons, or there's a lack of knowledge. There's a lack of knowledge. He is not being made aware of non-adherence. Then people believe in alternative therapies. Some people, if they are prescribed, like they'll go for alternative therapies, or homeopathy, Ayurvedic, instead of taking the mainstream medicines. Then they might not go to the doctor for follow-up. Certain diseases require constant monitoring and constant visits to the doctors, but certain people, certain patients, they just do not go for follow-ups. Patients then do not take medicine because of adverse effects, right? Sometimes they get adverse effects, and because of that fear, they will not take the medicines. Then some people are just reluctant. They go on a denial mode, right? They deny that I have a particular type of disease and I don't need this medicine. So it is belief related. Other factors are therapy related. Okay, how complex the regimens are, right? Sometimes the patient has to take multiple drugs for 3 times a day, right? If you can make that multiple regimens into simple regimens, like if a person has to take a medicine 3 times a day, so instead of giving him 3 times a day, if you can give us a stain release medication or an implant or a depot type of preparation which releases drug over maybe 8 hours, 12 hours, or even months. In hormonal therapy, you can give an implant to the patient where they release the drug over months, right? So instead of taking a pill every day, if there's an implant or if there's a transdermal system which releases the drug for a long period, that will simplify the regimen, right? So another factor is time to benefit. If the patients generally want to see the effect immediately, so if the time taken for the medicine to show the benefit is long, then also they will get impatient. They'll stop the therapy. right? And the duration of treatment, same thing, time to benefit and duration of treatment. If the duration of treatment is less, then they are more adherent than. So in acute, generally acute conditions, there is more adherence than chronic conditions. Then other factors are condition related, right? If a person has multiple chronic conditions, for example, if he has multiple diseases, he's taking multiple medications. So that affects adherence. Symptom severity, okay? If there are no symptoms, then the person will not remember to take the medicine. Right? If so, adherence is more if the symptoms are persistent or you have symptoms, then you will remember to take the medicine. If there are no symptoms, you will not remember. So, and if the person has depression, psychosis, and dementia, he is especially prone to non-adherence, and that person has to be reminded by caregivers or family to take the medication. Other major factor affecting non-adherence is the healthcare system. How is your relation with your doctor? Whether you are made aware of your therapy or diagnosis, whether you trust your doctor or not, whether his hospital that you go to, whether it has enough, whether it is patient-centered, it has enough physicians to take care of you, whether they are providing you with the proper knowledge, and whether you access. I mean, like sometimes waiting periods, like just simple as that. If you have to wait for a doctor for a long period of time, for long hours, then also that leads to non-adherence sometimes. So once you know what are the factors which affect medication adherence, then you can design the strategies to improve this. We know these factors, right? Now we can overcome these hurdles and do things so that these things get nullified and adherence increases. So adherence requires that a person shows interest in her health. Like compliance is only when a person passively follows the doctor, but adherence requires that the person who is taking medications shows interest in her health, in his or her health, and he understands the diagnosis, believes that the prescribed treatment will help, know exactly how to take the medication and how long this therapy is going to last. Then he finds ways to fit the medication regimen into his or her daily routine. I mean, like he ties his time of taking medication to his daily routine, taking this before tea or taking this after food or taking this after a walk, etc., etc. And the person should believe that he can carry out the treatment plan. Like you have to make him believe that whatever are doing is going to help you, make you treat your disease. And the person should trust the healthcare practitioners. He should believe that the healthcare practitioners, whatever they are doing for his health, and they are going to treat his disease. So based on the factors, again, these are some of the strategies by which we can improve medication adherence. The first is you can simplify the treatment regimen. As I told you, you can reduce the number of daily doses and pills wherever possible by using combination medications. If he has to take 2 antihypertensive drugs, then there are combinations available where they can combine these 2 drugs, or you can give a sustained release medication, or you can give a transdermal patch instead of oral medications, or a depot, so that he doesn't have to take more number of doses and that frequently. Then patient education can be done. Patient counseling is very important. Patient counseling is very important. You counsel the patient. You provide knowledge to the patient. To improve his health literacy, right? You ask the patient what is going to be convenient to him. You engage the patient in decision making. You tell the patient, see that this is your condition, and let us decide how we can design the regimen so it is most comfortable to you. So you can engage in shared decision making with the patients. Then you can use of technology and reminders. There are so many technologies and reminders available, which I'll be discussing in the coming slides, which help remind the patient to take their medications. Then there should be regular follow-up and support. You can schedule frequent appointments to monitor progress and address the issues, and establish a patient-centered relationship to build trust and accountability. Then sometimes the pharmacist gives incentives and motivate the patients, like if they come for regular refilling of the prescription, they give discounts for maintaining adherence. And they also motivate the patients by setting personal goals, like you walk so many steps in a day, or if you do this thing, then this will happen. You motivate them. Or you address the healthcare system barriers. If there are some healthcare system barriers, one of the factors which affects, so you can address those barriers by collaborating with healthcare providers to improve communication and coordination, or you can have developed protocols for medication, better protocols for medication management. Then if there is cultural sensitivity or diversity, some people, due to religious beliefs, they don't take some medicines, right? Because they are made up of animal substances and all. So there was a concern about, this similar concern when vaccines were prescribed for corona, right? Some people believe they use substances which are not allowed in their religion to take. So they were not taking those vaccines. So in that, you have to involve the community leaders, or whoever community leaders are there. For such people, you have to involve them, you have to convince them so that they can convince their people and bridge the communication gaps. Plus, you have to tailor interventions to suit. You have to do something which suits their cultural beliefs and practices. And you have to engage the family and caregivers for geriatric patients and pediatric patients and mental health patients. The family members and caregivers that play a very important role in medication, in adhering to their medication, right? So you have to educate them about the treatment plan and involve them in the process of setting the goals. So what the pharmacist can do for increasing adherence is very simple, right? So simplify the regimen, impart knowledge, simple it is, okay? Simplify the regimen, impart knowledge, modify patients' beliefs and even behavior, provide communication and trust, leave the bias, and evaluate adherence. Now, how do you evaluate adherence? You have done everything. You educated the patients, you improved the healthcare system, everything. But then how you have to evaluate whether what you have done is increasing the medication adherence or not. So there are different measures there are different tools to measure medication adherence. Some direct methods are there, some indirect methods are there. And there is a Morisky medication adherence scale from which you can determine whether a patient is adhering or not. Indirect methods, we have like checking the blood of the patients for the presence of medication or some metabolite or some biological marker which is present in the blood. So this is a direct method, which is a kind of invasive because you have to take the patient's blood. So this is not recommended, or maybe this is recommended in some diseases. Indirect methods are there where there are patient questionnaires. You give questionnaires to the patients which they fill out. Then patient self-reports are there. The patient writes the reports himself. Then there are pill counters, how many times the prescription is refilled. Then you can assess the patient's clinical response. The clinical response, or for example, you measure the blood pressure, etc., etc. And then you find out whether he's taking his BP medications or not. And there are some electronic medication monitors, which I'll discuss later. And there is Morisky medication scale, which tells you whether the behavior is intentional or unintentional. So what is this Morisky medication scale? This is the medication scale where the patient is asked 8 questions. Questions 1 to 7, they have to answer whether it is yes or no, right? 1 to 7, they'll ask yes or no. When he answers no, he gets 1 point. For all the questions except question 5, a no will get 1 mark. In question 5, a yes will get 1 mark, right? So question 1 to 7, you have to answer yes or no, where no gets 1 mark. For all the questions except question 5, where question 5 gets 1 mark for yes. For the 8th question, you have, this is a Likert scale. Okay, this is the Likert scale where you have to rank this. If you if you take this, you may get a score of 4, 4, 3, 2, 0, and 1. So whatever the patient takes, based on that, he will get either 4, 3, 2, 0, or 1 mark. So and on whatever marks he gets here is then divided by 4. Then addition of all these marks gives you a number. The highest score in this scale, what you get is 8. So if you get the score of around 7 or 8 or 6 to 8, then you can say that the patient is adhering to the medication. Less than 6 score is non-adherent to the medication. Then there are medication adherence tools, right? There are so many medication adherence tools available in the market now, which help the patient remember to take the medications, right? So some of these are listed here. We have pill organizer. This is a kind of a pill organizer, picture of a pill organizer, where the pills are put in the boxes named by the days of the week, Sunday to Saturday. Similarly, on strips, we also have, if the person has to take medication for 21 days or for the whole month, then the dates are written on the strips. So the patient does not forget, like if he sees these things or the strips on which the number of days are written, then he can immediately come to know whether he has taken or he has missed the dose of that particular day or not. Then there are various reminders that are available in the market now. Example, these are some of the medication reminders which are available in the market now, where we have a tab timer. This is like a tablet, okay, where you can put, this is like an alarm system where you can put alarms which go off or go on every 8 hours or every 6 hours whenever you have to take the medicine. So it will send an alarm and remember that you have to take the medication. This is the e-pill time cap and bottle, where the cap of the bottle has the time. It tells you the time when the bottle was last opened. So by if 12 hours has passed when you last opened the bottle, that means you can find out, you can come to know how many doses you have missed or whether you have missed any dose or not. Here the cap has the timer. Here it is a kind of alarm. Then there's a pill pack by online pharmacies. This is a you know what is Amazon, right? So if you subscribe to this pill pack, they will deliver the pre-ordered or pre-dosed medicines to you. So this does not give you a daily reminder like these do. These two things give you daily reminders, but this does not give you a daily reminder. They will automatically fill your prescription and deliver it to you free if you subscribe to this pill pack. Then MediSafe is a mobile app. This is an app which you can download on your mobile. You can put down all the information about you, how many medicines you take, at what time, and how long you're supposed to take. So they will send you alerts. They will send you either SMS messages or whatever alerts they have to, so that you can get up and take your medicines at that particular time. Sometimes these are free, and sometimes you have to take the subscription so that they can offer more services. And these things are not linked to any pharmacy, but this mobile app is also linked to a pharmacy. So you get advice from the pharmacist regarding some of the treatments. And this is a kind of a pill dispenser, right? This is connected to the Wi-Fi of your house, and there is a sensor which sends signals, right? So whenever it is time for you to take the medicine, this dispenser is going to dispense the medicine in this cup. After dispensing the medicine in this cup, it will send a signal to you through the Wi-Fi of your house. So you just have to come to the dispenser, take whatever is dispensed, and then take the medicine. This is kind of a costly thing. Other things are not so costly and can be used by patients. Some more medication adherence tools are mHealth, eHealth, and eMMDS. So mHealth is an abbreviation for mobile health. Again, it is an app. So patients are able to record their treatment schedules. They can store and monitor their health records on their personal mobile devices. And it was surprising for me to know that there are over 318,000 health apps available in the market from which you can choose. And popular examples of these M-Health include Fitbit, which many of us now use, Google Fit, and Apple Heart Study. E-health, it's a much broader understanding than M-Health, and then this technology used the technology used here. So technology used to improve healthcare practices with e-health, they include electronic health records, the health record of patients, then patient administration systems, lab systems, and other records. So all your lab records are also stored in this e-health system, which is much broader than the mobile health system. So things which cannot be stored in your mobile health application can be stored in e-health, right? And then last we have eMMDs. These eMMDs use audio and visual signals to prompt the patient when they have to take medication, dispense medication, and gives instruction to the patient, or they can contact the caregiver or your family member in case whenever it is needed. So these are the apps and some tools which are in the market for people to use who cannot adhere to the medication because just because they don't remember, right? It is unintentional. When it is intentional, it cannot be cured by these. But when it is unintentional, we just forget, then you can use these things. These are some of the companies which are there in the market today who have come up with all these medication adherence tools, and they are doing very well. How well they are doing and how well they will do can be seen from this global medication adherence market by value. The value is the global medication period from 2018 to 2028, US $1 million. So in 2021, the global market for medication adherence tool was $2,668.1 million US dollars, which is predicted to increase so much. I cannot see this, which is predicted to increase up to 5,562.3 in about 2028. So the market for this adherence tools is predicted to increase so much around 2028, up to 2028. This also indirectly tells you that how the problem of medication adherence is increasing day by day in the world, right? And how we really need the tools so that people can adhere to their medication schedules and improve the quality of their life or improve the diseases and contribute to the overall health of the nation. So here I conclude. So medications generally do not work in patients who do not take them. We have to take the medications properly so that they help treat us. So medication adherence is crucial in achieving positive health outcomes. And by addressing barriers and implementing effective strategies, we know the barriers, so hence we can implement effective strategies. We can enhance patient adherence and the overall well-being of human beings. Thank you. I'd like to take any questions if there are.
Thank you, ma'am. But there is no questions for. Thank you, ma'am, for sharing this wonderful knowledge with us. And there is no questions from the participants.
Okay.
Okay. Thank you, ma'am.